Hello everyone, my name is Jonathan Cook and I'm excited to give this presentation today. It's been fun to see everyone else's. Kind of a shame going towards the end of the week, but I'd be lying if I said I wasn't appreciative of the extra time to refine my presentation here. I'll be giving my presentation today on xenotransplantation. I'll be going into more specifically what xenotransplantation is and how it can better fulfill a role as a tool in health practitioners' belts. But overall, it's a tool to help fight against the organ shortage, and we'll discuss more about why that is an important component of healthcare. Before I get into that, get a little bit about me. I'm a biology major and a pre-med student, and I'm very excited to be graduating next semester. I'll be applying to medical school in about a month or so, did the MCAT about a week. So it's a very busy but exciting time. I currently work as an EMT for Spanish Fork City, and it's a job I appreciate. It gives me an opportunity to really connect with the community and see a bit of what we learn as biology students in action. I'm a husband and father, and I'm very passionate about curiosity and learning, a trait that I'm hoping to instill upon my daughter here. You can see the My First Elements book. And I'll just let you guess, based on the pictures I selected, which of these I'm most proud of. Anyway, so xenotransplantation, I want to discuss in three veins of thought today. I want to talk about the importance of enhancing our approach to treating those in need of organ transplants. It's a very critical area of care for a very vulnerable population of patients. Our present technologies have some very stark limitations. So I'm going to be talking about what xenotransplantation is and how it can be implemented more effectively to treat these patients. So as for the importance of developing new technologies, these are some statistics that I gathered from the Health Resources and Services Administration, showing that every day 17 people die on the transplant list, and every 10 minutes another person is added to this list. And just barely over a majority of Americans are signed up as donors. Even if we get that number way higher, we're still essentially waiting for somebody to have a pretty tragic accident in order to free up these organs from those who are presently using them. So at best, supply can just never meet the demand, and it's a little bit woefully underwhelming in the results that it can do with how many are lost to it. Some of the technologies that we're investigating are artificial ways to treat those who are on the donor lists, like you can think of dialysis for kidney patients, or artificial, like mechanical pumps to help circulate blood in those with deficient hearts. But as those are developing, there are certainly other tools, and I think that xenotransplantation can fill the role of that. So, what xenotransplantation is, xeno, the prefix meaning foreign, indicates that these organs are sourced from something non-human. This non-human donor is often a pig for a number of reasons. The first is that they have a smaller lifespan, so they mature quickly, allowing the much-needed hearts to enter circulation to treat patients much quicker. They're anatomically very similar in both pediatric and adult patients, in that like a small pediatric, if you would, pig is anatomically similar in terms of its organs to that of a human patient, and adult to adult patients as well. And they also have many offspring per reproductive event. The litters of pigs are quite large, which as we talk about the genetic modification that needs to happen to make these organs viable, it can be cost prohibitive. So having a large litter of offspring allows to diffuse that cost, making it more effective as a treatment. Now, these donations, these xenotransplants, can take the form from a cellular level all the way up to complete intact organs. So you can see common uses on a cellular level are porcine pancreatic cells, which allow for the secretion of insulin reacted to like physiology and the way a normal pancreatic cell would operate, allowing for type 1 diabetics to have a better response to changes in blood glucose rather than just administering human insulin. You can genetically modify the pig pancreatic cells to secrete the insulin. You can do on the tissue level, often it's skins for burn victims, as well as you can transplant vascular elements like aortas or veins, and it can be up to entire genetically modified organs like kidneys and hearts most commonly. So this is a most recent and very successful use of xenotransplantation done at the University of Maryland Medical Center and School of Medicine. It was a heart transplant given to a human patient who was unable to receive a human transplant. And it allowed him to receive, like, the blood was be able to pump and fill that physiological role with the porcine heart. This is the before and after, respectively. The process for making and preparing the xenotransplantation is a long, costly, and complex one. It starts with the genetic modification, largely centered around the immune response, but we'll discuss that more specifically later in the presentation. But there are some morphological modifications that can be made. So the genetic modifications must be made to the tissues and the organs, and the immune response, which is responsible for like graft versus host disease and rejection in human-to-human transplants, is even more prevalent in xenotransplants. So it's a very complex process in identifying all the elements that are responsible for the rejection of the xenotransplant, to modify mitigators into that. There's a lot of preoperative care, both in terms of the humans and the donors. There's a lot of endemic diseases within pigs that are specifically harmful to humans, which must be treated, as well as supporting the human patient while they wait for the transplant to be readied. And there's also, on the other end, if you transplant human genes into pig patients, there is the risk of immune response within the pig as it's developing. So there are preoperative care in terms of the donor that needs to be done to keep the organ healthy while transplantation occurs. Over the course of the actual transplantation procedure, there are modifications that need to be made to that procedure to make the xenotransplant more compatible. Things like where slight variations in where valves may be located, or larger morphological changes in like where kidney connectivity is implemented in humans and pigs. So it's a much more complex procedure to do a xenotransplant as opposed to a human transplant, just because of those variations. There must be adapted procedures to fit the xenotransplant. And as with all transplantations, there's a lifelong postoperative care in terms of immune response suppression in order to protect that transplant, which is even more exacerbated in terms of the xenotransplant, just because of all those little differences that we'll discuss later. Each of these sections contains obstacles that I've hinted at a little bit, but in order for xenotransplantation to be a more readily available solution to treating these critical patients, advances need to be made in each of these sections. So the first, improving the technology for better patient outcomes, largely is in response to allowing the transplant to better camouflage in and be resistant to effects of the adaptive and innate immune response of the humans that are the recipients of the transplants. So the immune, this will be review largely for many biology students, but the immune system is divided into two categories: the adaptive immunity and the innate immunity. The adaptive immunity is largely regulated by antigen and antibody responses. So in the cellular membranes of all cells, there are various antigens that are used to communicate with other elements of the system. These are often like self-recognizing antigens. The self is a small molecule that will indicate to other aspects, and especially to the specialized immune cells, that the cell is part of the organism and shouldn't be attacked and should be protected. And these are all unique to individual species. So if you were to take an ungenetically modified pig heart and place it in place of a human heart, all of the endemic porcine self-recognizing antigens would indicate to the human immune system that, hey, this is a pig heart. This isn't supposed to be here. This is a potentially invasive disease, and it will secrete antibodies which will destroy functionality and ultimately cause rejection. So the other half of that is the innate immunity. These are non-specific chemical and molecular responses like histamine, bradykinin, prostaglandin. These all cause inflammation and non-specific attack and degradation of potential invaders, and that also includes the organs. And this is the much faster response. Like the hyperacute rejection seen, like immediately after an operation, is largely a response more of the innate immunity, whereas the specific response takes time to develop. So the genetic modifications take the forms of either knock-ins or knockouts. These are both terms used to describe whether you are deleting a gene or inserting a new one. So when you're taking the pig organ and modifying its genetic composition, the modifications center largely on introducing the human self-antigens and deleting the porcine ones. So this has problems when you're raising up the pig, in that if left without suppressing the immune system, all of a sudden the problems that would have been in the human patient are in the pig patient. So immune suppression and other genetic modifications to the pig must be introduced in order to allow the pig to fully grow and develop that organ for human transplantation. These are done with deletions or sometimes duplications of certain, if you want to upregulate elements of immune resistance, and as well as the insertion of the new genes. These are largely the antigens, but there are also genes that have been identified that enhance the resistance to the inflammation. And the furthering of the technology will require the identification of currently unknown antigens and genes which could enhance the survivability and the ability of the organ to blend in the new system. The second consideration are the ethical implications involved in use of xenotransplantation. So these divide into two categories. There's the view of like the animal welfare aspect, as well as the implications involved in giving one human patient a xenotransplant and the other a human organ. So there are two sort of schools of thought when it comes to the ethical implications. As for the animal welfare side of the deal, there are numerous and growing animal welfare organizations which advocate for the life and well-being of animals, and it's an important thing to consider as you're developing a system of treatment which relies on the removal of critical organs from a pig, ensuring that it will die in place of the human patient. Ultimately, this is the lesser of the two ethical considerations, because we already use pigs and other animals as food sources, which are brought up and raised and killed in much less ethical ways. But for this to be a sustainable solution to the organ shortage, guidelines must be put in place that ensure the ethical sourcing and development of these organs, both in the genetic modification, the raising up and the lifespan of the organ, and the ethical removal of those organs, to ensure that the animal welfare is maintained. And as I mentioned, the largest are the ethical implications of treating patients differently. So central to like the doctor's creed to do no harm, there's also ethical laws that ensure that there isn't discrimination. You can't treat one patient demographic another way than you would another. That includes even those who undergo or who live with riskier lifestyles, like, for example, smokers or people who drink heavily, which is known to damage organs. Doctors can't give different levels of care to different patients regardless of anything there. So the implications being that xenotransplants are inferior in a number of ways in terms of their efficiency to get the job done. Like a xeno kidney is going to filter blood less effectively than a xeno heart, or than a human kidney, and xeno heart to human heart. Similarly, advances in the genetic modifications of the morphology can help mitigate these issues, but it's likely to still be an ongoing problem. And there's also the issue with longevity of the organ, which we will discuss in the future. So there have been proposed and need to continue to develop ethical guidelines that support the use of xenotransplantation. So the New England Council of Bioethics has proposed a series of guidelines that can help ensure that this is implemented in an ethical manner. So the first is the duty of care that doctors take. Largely, xenotransplants have been proposed as a solution to those who would not be able to receive a heart transplant, or a human organ anyway. Like people who are on the waiting list for lung transplants can be disqualified if they continue to smoke, for example. So this could be an opportunity to fill in and treat a patient who would otherwise be turned away and give them enhanced quality of life. Other proposed uses of xenotransplants is to enhance the survivability of those who are waiting for a more definitive organ. Currently, like kidney patients are placed on dialysis, which has its limitations. So if more effective xenotransplants can fill that role, the patient can be sustained while they wait and survive longer on that kidney transplant for a definitive human organ. In addition to the duty of care that doctors take upon them to act, on behalf of their patients. Patients also have enshrined laws of autonomy, saying that they are able to dictate the care that is given to them. This allows patients to decide for themselves to receive a xenotransplant, for example. There's also the contribution to science that xenotransplants could. This is essentially a tick in the balancing the scale more towards its use. Every time xenotransplants are used, we can learn from them and enhance the efficiency until maybe eventually they are nearly as inefficient or inferior to human organs, which would greatly reduce the amount of human suffering involved on those receiving transplants. So those are the three proposed supporting elements of its use. But in order for these to be done effectively, there needs to be ethical oversight and accountability. Ethical oversight in terms of it, medical administrators and elected officials who dictate and enshrine the whens, hows, and wheres of xenotransplantation's use, and the accountability of the medical practitioners who perform the xenotransplants to account for their work and be able to show that they have been treating their patients with an equal quality of care despite any differences that may be like between the xenotransplant and the human transplant. There are times and places where xenotransplants can be very effective, very helpful, and reduce human suffering. And if practitioners are accountable to the times which they use them, then the ethical oversight can ensure that everything is above board and that the ethical guidelines are being followed and supported. And the last aspect of obstacles that need to be overcome to the longevity of the transplant patients. And this is very, very critical because the best case of the transplant, that heart transplant I showed the picture of earlier, that lasted 60 days, which is 60 days longer than the patient otherwise would have been able to have, but is, I would say, a far stretch from being the solution to the organ shortage. So this the longevity is largely from the accumulated degradation from the inflammation. So everyday medications are being proposed and developed to treat various illnesses, and inflammation being large among them. As we continue to develop medications to suppress inflammation and to suppress rejection of the medications or of the transplants, they will be able to survive longer within the transplanted system. The genetic modifications could also grow to include the morphological changes and the disparities that we mentioned earlier, which can enhance the effectiveness of the organ. The kidneys will be able to filter blood more effectively, and the hearts will be able to pump blood more effectively, until the differences between the human transplant and the porcine or other animal xenotransplant are much more negligible. So in summary, xenoplant transplantation, I believe, can grow to be a very powerful and effective tool in preventing the tragic losses involved by the need for organ replacement. It needs to be done by enhancing the technologies that allow the organ to blend in, camouflage, and get its job done, by creating ethical guidelines that dictate how it should be used and operated and what role it should fill as a tool in medical practitioners' tool belt, and to increase the longevity and effectiveness of that transplant once it has been transplanted. These are my citations, and I look forward to hearing your feedback on the presentation. Thank you for watching.